Welcome back to Health and Life. I'm Catherine Barrett. Lifelong health. In healthcare, that's a phrase that may be new to you and me, but at Riverside, it's really at the center of everything they do. I'm joined by Mike Martin, Riverside Senior Vice President for Lifelong Health. Mike, thanks for being here.
It's good to be here.
Tell me about this concept of lifelong health.
Well, first, it's a philosophy of care that says that we value people regardless of age or infirmity. And I think that that's an extremely important part of what we do. We have a vision statement at Riverside that we will not provide or launch a service that does not live up to our vision statement of keeping people in control of their destiny in a place of their choosing, especially as they age. We also recognize that there are many life stages and that the later stages of life are longer than they've ever been, number one, and then also that they require a different approach so that we can help people live a high quality of life. And then finally, Riverside, by most standards, has the largest network of services for older adults in the state of Virginia.
It sounds like you have a very strong focus on the older adult.
That's true. Riverside provides services and care to people at all life stages, but my job is specifically geared towards aging-related issues and older adults.
Now, careful now with this next question. How do you define the older adult?
Well, you'll be happy to know, Catherine, that it's not necessarily the number of candles on the cake, but medical science has truly allowed us to live a very long life, but often we have to suffer through a number of disabilities and things that don't allow us to have a good quality of life. What Riverside has done is truly being able to help you with those things in a way that you will have a good quality of life. So what is most important, I think, for people to know out of this is that you have to manage chronic illness and you have to find a primary care physician that can do that. So around age 50, if you haven't already, you should have selected a Riverside primary care physician that can help you with those things.
And when you reach age 65, there can be some anxiety about finding a doctor who accepts Medicare.
Yeah, I think that clearly in our country, people that have reached that age have had difficulty finding a physician, or they may even lose the physician that they've had. But that's the unique promise of Riverside Health System, that you will absolutely find a Riverside Medical Group practice to help you as you age.
Of course, it's one thing to live longer, but it's a whole other thing to live better.
That's absolutely true, and that's really at the heart of what Riverside does. We have amassed a number of services, quietly gone about developing the infrastructure and the things that people absolutely need to age well, including things like continuing care retirement communities, home health care, community-based care, care navigation, our program of care for all-inclusive care for the elderly. All of these things are meant to be allow people to age well. They're at the center of everything that we do.
That's a lot of services, and frankly, that sounds unique to me.
It's very unique. I think the kinds of things that Riverside has done in the past through our leadership. We have over 3,000 employees that are some of the greatest people that you'll ever meet, taking care of thousands of older adults every day in ways that you could hardly imagine.
Thank you, Mike. Stay with us and we'll talk about aging in place and some of Riverside's advances in home health technology. If you'd like assistance finding a doctor in your area that accepts Medicare, visit riversideonline.com/Medicare or call 757-875-7880.